Antiplatelet drug. Antiplatelet drug. A drug to make the platelets less sticky and thereby help prevent blood clots from forming in the arteries. Platelets form clots and stop bleeding. If there are too many platelets or the platelets stick together too much, they are more likely to form clots. Clotting can take place on the inside of arteries and lead to heart attack when it forms in a coronary artery or stroke when it forms in the brain. Examples. Mechanism of action. Aspirin irreversibly inhibits cyclo-oxygenase, COX-1, the enzyme required to make the precursors of thromboxane within platelets, that reduces thromboxane synthesis. Thromboxane is required to facilitate platelet aggregation and to stimulate further platelet activation. P2Y12 inhibitors. Thienopyridine, platelet adenosine diphosphate, ADP, receptor. Antagonists, through binding to the platelet P2Y12 receptor. ADP induces platelet aggregation via the activation of P2Y1 and P2Y12. Prodrugs requiring hepatic biotransformation into active components via hepatic P450 enzymes, glycoprotein IIB, IA, GPIIB, IA, inhibitors, prevent platelet aggregation by blocking glycoprotein IIB, IA receptors on the platelet's plasma membrane, and inhibiting fibrinogen and von Willebrand factor, VWF, from binding to the receptors. Used along with aspirin in patients with acute coronary syndromes, ACS, such as unstable angina and non-street elevation myocardial infarction requiring percutaneous coronary interventions, PCI, within 24 hours. However, after the introduction of oral P2Y12 inhibitors, its role is decreased. Phosphodiesterase E, PDE3 inhibitors causes blood vessels to relax and widen, improving circulation and lowering blood pressure. Treats different medical concerns, conditions, and diseases, including post-surgery thromboembolism, clotting prevention, and thrombocythemia. Examples of P2Y12 inhibitors. Clopidogrel, ticlopidine, has been supplanted by clopidogrel or prasugrel due to concerns over drug-induced thrombotic thrombocytopenic purpura. Ticagrelor or prasugrel, cangrelor. Examples of GPIIB, IA inhibitors. Tirofiban, eptifibatide. Examples of PDE3 inhibitors. Dipyridamole, cilostazol.